So you want to know about evidence-based practice. Well, here's the run-through. It's broken into 3 major components. There's research, and then there's clinical expertise, then there's patient preferences. You gotta have a balance of these, because if you use patient preferences and research, you're gonna look like you don't know what you're doing and look incompetent. Yeah, I know, right? Keep nodded. Anyways, if you use clinical expertise and research, you're not gonna have any empathy for your patient. It's gonna look like you don't really care. Then if you use clinical expertise and patient preferences, it's gonna look like you don't really have any mind of what you're doing, because you're doing what the patient wants. You don't have any progress going on, right? So then you're gonna need to know what kind of questions to ask. So you gotta know like what to do, because you gotta know the patient problem, you gotta know the intervention, you gotta know the comparison, and then you gotta know the outcome, right? Because once you know the outcome, you're gonna ask different types of questions, and these types of questions are gonna depend on what type of research you need, right? So then when you need research, you're gonna go through different types of research, and you wanna get as valid a research as you can, right? So you need to make sure you get something high up there. So you wanna get systematic review or meta-analysis, because systematic review is thoroughly researched over one topic, and so it's all compiled and right there, and is like seen over by many experts to make sure that the data is valid. Then the meta-analysis is all super thoroughly researched over the topic, seen through by many experts, and it's all compiled into one area. So then it's all just right there, and you have everything you need, right? But then with that, you got to know the qualitative versus the quantitative. And the qualitative is the observation in natural situations, right? But then the quantitative is strict controls in the conditions, right? And so like the numerical data. And with that, you just got to know like what you're kind of looking for. You understand?